This video was created to demonstrate 3 tests that can be useful in determining which patients with chronic pelvic pain would benefit from further examination and treatment by a specialized pelvic physical therapist for musculoskeletal dysfunction. These tests are based on recent evidence, especially the work of Colleen Fitzgerald and Cynthia Neville. Please see my website for references, www.bethshelley.com. The first test is called the force Faber. This test has a specificity of 0.78 and correctly classified 89.5% of chronic pelvic pain patients in a blinded controlled study. The force Faber has a 85.6% inter-examiner agreement, making it a very valid and reliable tool. The test is performed with the patient in the supine position. The hip is bent, abducted and externally rotating, placing the foot on the opposite thigh. One hand stabilizes the ASIS, the other hand gives a force to the knee, and a positive test is when pain is provoked. The test would then be repeated on the other side. The second test is called the posterior provocation test, or P4. It has also been shown to have an 87.5% inter-examiner agreement, making it a very reliable tool for the diagnosis of musculoskeletal pelvic pain. This test is performed with the patient in the supine position, the hip is bent at 90 degrees, and a force is given through the long axis of the femur towards the table. Pain provoked in the ipsilateral buttocks is a positive test. The test would then be repeated on the opposite side. The last test is palpation of tenderness in the pelvic floor muscle vaginally. Inter-examiner agreement of this test is 79.2%, and tenderness was present in 81 to 88% of patients with chronic pelvic pain in several different studies. This test is performed during vaginal examination without a speculum. The index finger is used to press firmly on the pelvic floor muscle on the right and left at the level of the levator ani muscle, here and here. Pain provocation is graded as a positive test. Palpation of the pelvic floor muscle should also be carried out deeply in the deeper areas of the levator ani and to the coccygeus on both sides, as well as the obturator internus muscle inside the vaginal canal. Patients who have positive findings in any of these 3 tests, the force Faber, posterior provocation, and pelvic floor muscle tenderness, would benefit from evaluation and treatment by a specialized pelvic physical therapist, as a musculoskeletal component of the pelvic pain is most likely. Please check my website for further information and references, www.bethshelley.com. You may also post questions and comments on my blog, www.pelvicpt.blogspot.com. I value your input, as this is an evolving area of medicine.